saving lives and reuniting people in just one vial of indistinguishable clear liquid. But the real magic has been the scale, the industrial production, the shared effort, all culminating in small, very private, intimate moments in halls and surgeries around Britain.
That's all done.
The beginning of the end of the pandemic comes so simply and quickly.
I'm feeling very excited, very privileged, and really pleased to have had it.
It's very easy, the process, the volunteers, everyone's in their place and helping us.
No wonder the Prime Minister wants to be seen here at a GP-led vaccine centre in Kent, where they tell me they expect soon they'll be weeks ahead of schedule, even as Boris Johnson tries to tell the nation that there are likely to be lots of restrictions that stay for now.
No vaccination programme is 100% effective. And so when you have a large volume of circulation, we've got a lot of disease, inevitably the vulnerable will suffer. And so that's why we want to drive it right down, keep it right down.
It's in vaccination rooms like this one that Britain is getting its passport out of coronavirus. But what will the new normal look like? Boris Johnson told us today that no vaccination process is 100% successful. One of the biggest arguments, therefore, inside Whitehall right now is whether or not to keep social distancing. Will the 1 metre plus rule survive? If it does, that could mean fewer customers in pubs and bars and restaurants, some of them going under. But some government scientists think it should stay. The vaccine programme a success, but not the time to abandon all restrictions.
This is an unprecedented national achievement, but it's no moment to relax. And in fact, it's the moment to accelerate, because the threat from this virus remains very real. We want this lockdown to be the last, and we want progress to be cautious, but also irreversible.
Prime Minister, you warned this morning that no vaccination programme is 100% effective. Professor Chris Whitty, what are the implications of this for protecting public health? Do you think some social distancing measures will now become permanent?
The risk will gradually go down, so it won't suddenly move from you having to do everything to nothing. Whether it'll get it down to the point where it's zero for all time, or whether it'll take it down to a very low level where there's some residual risk, or a level where very occasionally we have to do things in particular points in the season, for example, I think it's too early to say.
The army's still assisting as the vaccine rollout pace now doubles, jabbing for victory. Sam Coates, Sky News.